everybody. Thank you for joining us for another recording of SoundBytes, a mini podcast series raising awareness about the impact of living with dysphagia. While most of our recordings feature people living with dysphagia, it's my pleasure to interview somebody today who is helping to make life better for those impacted by difficulty swallowing. I'm excited to introduce you to Dr. Apoorva Ramaswamy, who is one of the Foundation's board members. And Apoorva, I'll have you introduce yourself if that's okay.
Yeah. Thank you so much for having me on, Elizabeth. I'm so excited. So I am a laryngologist, which is a throat surgeon, and I was lucky enough to be trained with Dr. Peter Belafsky, who is one of the founding members of the NFOSD, and I have been, passionate about dysphagia for many years, but it really seeing the ways that we can treat it and improve people's lives was one of my favorite parts of that fellowship, and seeing everything that we get to do through this organization has been really inspiring.
Excellent. Thanks for introducing yourself. Quick question for you. How did you first learn about the National Foundation of Swallowing Disorders, and what motivated you to join its medical advisory board?
So the reason I got into dysphagia in the first place was because this is a huge problem, which basically, swallowing problems affect many people with many other health conditions. It's a symptom often of many, many different health conditions, and very undertreated in a lot of settings, and a lot of funding and everything is lacking. So I started to become more aware of the foundation because I was becoming more involved in trying to treat dysphagia and realizing that we have so many gaps. And, I was brought in by Dr. Belafsky and got to meet yourself and Ed, and really seeing all the ways that we can and need to move the ball forward in this field and really get people the care they need, because whether you've had a stroke, neurodegenerative process, whether you've had head and neck cancer, there's so many ways that dysphagia can be affecting your life, and we really as a healthcare community have so much more to do in improving people's lives.
Absolutely, and thank you for recognizing that dysphagia affects more than just your swallowing. It affects people on so many different levels, and it can be challenging to manage all of that. Can you highlight what you consider some of the most pressing issues or misconceptions surrounding dysphagia and its management?
So I think in terms of the mismanagement and kind of misconceptions, I think is the fact, at academic institutions, we really, with our swallow therapists and the throat surgery and the GI doctors, have such amazing multidisciplinary teams and people who are focused on treating swallowing disorders and swallow impairment. But so many people out in the community really are told that there's really not much you can do. You have to live with this G tube. You kind of have to live with this quality of life that is unsatisfying for you, because maybe it's the safest thing, or because there's really no other treatments. And I think that has been the most important thing for me, is telling people that first of all, this is your life. Eating is important, and if it is important to you, it is our job as a healthcare community to give you the quality of life that you want and need. And second of all, that there are things that we can do, whether it's therapy or a procedure or something else or a clinical trial. There are things that are happening, things that we can do. And so that, I think, is the biggest misconception, I think, in this field, and mostly from people outside of it or adjacent to it. And I think in terms of pressing concerns, aside from just awareness of all the things that we can do, is that there is a lot of lack of funding for a lot of what we do. So part of the reason that this is so under-addressed is because it is under-resourced. And so until we can really get consistent reimbursement for therapy, consistent reimbursement for the procedures that are done, we really can't make this an accessible treatment. It's going to be only accessible to a few people around a few academic centers, and that's really not the kind of quality of care that we need to provide as a society.
Of course, yeah. What I'm hearing you say is we need to treat the person and not just the problem, but we need the means to be able to treat the person and the problem. how, this is obviously a big problem, and how can people, whether you're a healthcare professional or a person living with dysphagia, how can you help kind of drive this change in the medical field to get more coverage and reimbursement?
Yeah. I think a lot of it is through what we're hoping to do through the NFOSD, but awareness, actually becoming a vocal group that says that, hey, this is a problem. We know that we have maybe diverse different, diseases, but we all have this problem of dysphagia, of swallowing problems, and we need this to be fixed. This is not just about quality of life. This is extremely central to our human identity, to be able to eat, to sit with our families, to social engagement, psychological health, nutritional health. Being on a tube feed is not the same as eating with your own mouth and throat and organs. And that is so important. And really making that something that is top of mind for lawmakers, for legislatures, for people who are kind of in this role, because it is something that people just aren't aware of, and that's on us to make our voice heard.
Absolutely. We have a few initiatives in the work too, and I'll share more about those later. But one includes meeting with some FDA stakeholders to try to increase awareness of the lack of treatment options for people living with dysphagia to help improve funding for some new research. And we'll see where that takes us. But I have another question here for you. What is your favorite part about treating people with dysphagia?
Oh, this is my favorite thing. I mean, I feel so lucky to get to do what I do. It's every Thanksgiving and Christmas, those are my usually like the busy season, because people want to get procedures done so that they can eat with their family and sit down and enjoy their meals. And that is just so amazing to me. I have, patients who had complete esophageal stenosis for years, and then they came and told me that they were able, after multiple procedures and their swallow therapy, they were able to eat a Snickers bar for the first time. And getting to hear that from a patient, that is my absolute one of my favorite things in the world. I feel so lucky to get to do that. So yeah, I'm sure you would agree. That's probably one of the most amazing feelings.
Yes, yeah, I think that's why people get into this, is to help others. And certainly when you help them to that level, it's so rewarding. I have heard from somebody who saw you as a patient and shared this with our organization, saying that you saved their life because they had seen other physicians, other speech pathologists before who said there's no hope for you. And what you gave this man was hope. And even if he's not eating 100% normally, he's able to eat something, and that means the world to him. And so
Mhm.
thank you for all that you do for the foundation, for your patients. We appreciate it, and thank you for taking the time today to talk to us.
Thanks so much. Thanks for having me.